Good day, everyone. For today's recording session, we will be presenting to you a topic regarding the communicable diseases, particularly influenza. So, for our objectives, at the end of the reporting, we may be able to explain what is a communicable disease, define what is influenza, present public health nursing responsibilities in relation to influenza, demonstrate specific treatments of locally endemic diseases, and discuss various programs of the Department of Health related to influenza. Before we go into specifics, let me introduce to you first what is a communicable disease. So, communicable diseases spread from one person to another or from an animal to a person. The spread often happens via airborne viruses or bacteria, but also through blood or other bodily fluid. The terms infectious and contagious are also used to describe communicable disease. Now, let's proceed to the discussion regarding influenza. By definition, influenza, or commonly known as flu, is an acute, highly communicable disease caused by influenza viruses that infect the nose, throat, and lungs, characterized by abrupt onset with fever which lasts 1 day to 6 days, chilly sensation or chills, aches or pains in the back and limbs with prostrations. Respiratory symptoms include coryza, sore throat, and cough. For its etiological agent, these are the disease causative agent that causes disease influenza. Specifically, these are the influenza virus A, which is generally considered worse than type B influenza and causes influenza to some birds and some mammals. Influenza virus B, which is only known to infect humans and seals, and influenza virus C, which are known to infect humans and pigs. In addition, this type of virus commonly causes cold-like symptoms and sometimes causes lower respiratory infection, especially in children below 2 years of age. On the other hand, its source of infection is the discharges from the mouth and nose of infected person, while its mode of transmission is by direct contact through droplet infection, or by articles freshly soiled with discharge of nose and throat of the infected person. This is also airborne, meaning it is transported by air. So now let's proceed to its incubation period. So by definition, it is a time interval between initial contact with an infectious agent and appearance of the first sign or symptoms of the disease. So it's usually short, usually 24 to 72 hours or 1 to 3 days. While its period of communicability, or the time during which an infectious agent may be transferred directly or indirectly from an infected person to another, from an infected animal to humans, or from an infected person to animals. So probably limited to 3 days from clinical onset. Now, talking about its susceptibility, resistance, and occurrence, it is universal but of varying degrees as shown by frequent and apparent and typical infection during epidemics. Occurrence is variable. In pandemics, local epidemics in sporadic cases, often unrecognized by reason of indefinite clinical symptoms. Infection produces immunity of unknown duration to the type and subtype of infecting virus. Methods of prevention and control. These are the following. Education of the public as to sanitary hazard from spitting, sneezing, and coughing. Avoid use of common towels, glasses, and eating utensils. And active immunization with influenza vaccine, provided prevailing strain of virus matches antigenic component of vaccine. There are also public health nursing responsibilities that we must take note. First, we isolate patient during acute stage, then report the case to local health officer immediately, and then during epidemics to minimize severity to protect patient from secondary infections, thus reducing mortality. patients should be instructed to go to bed at the beginning of the attack and not to return to work without the approval of the physician. As we are in behalf responsible in making sure that our patients' health is well prioritized and treated, the nursing care are as follows. Keep patient warm and free from drafts in bed. Keep patient away from persons suffering from respiratory tract infections to prevent pneumonia. Tepid sponge bath for fever and use the proper technique as a teaching tool to a responsible member of the family. Teach and demonstrate proper sneezing and cough technique by the use of paper tissue to cover the mouth and nose during cough and sneeze. Teach the burning method or disposal of contaminated tissues and newspaper. And clothing soiled with throat and nose discharges should be boiled for 30 minutes before laundering.
There are prescription medications called antiviral drugs that can be used to treat flu illness. As per CDC, they have recommended that prompt treatment is needed for those people who have flu or suspected flu and at the same time at higher risk of serious flu complications such as people with asthma, diabetes, or heart disease. Specifically, flu antiviral drugs are prescription medicines that fight against flu virus in your body, and you are not sold over the counter unless prescribed. These drugs include oseltamivir, zanamivir, peramivir, or baloxavir, which may shorten illness by a day or so to help prevent serious complications. In addition, there are also possible side effects associated with antiviral medications, which includes nausea and vomiting. These side effects may be mitigated when taken with food. On the other hand, there are also lifestyle and home remedies available for mild flu. These measures may help ease your symptoms such as drinking plenty of liquids to prevent dehydration, acquiring enough rest to help your immune system fight against infection, and considering over-the-counter pain relievers such as acetaminophen or ibuprofen to combat the acheness associated with influenza. However, children and teens recovering from flu-like symptoms should never take aspirin due to the risk of Reyes syndrome, a rare but potentially fatal condition. Let us now proceed to the DOH programs. They have the National Immunization Program and they have the seasonal influenza vaccine. Most seasonal influenza vaccines are trivalent, containing 2 strains of influenza A and 1 strain of influenza B, chosen based on known circulating strains. The influenza vaccine, also known as flu shot, is an annual vaccination using a vaccine that is specific for a given year to protect against the highly variable influenza virus. Seasonal influenza vaccines are usually effective if given during the right time, according to the circulating strain in a particular setting. Vaccine effectiveness is dependent upon the extent of the match between the virus strains used to prepare the vaccine and those viruses in actual circulation. Research has shown that when there is a good match between the virus strains chosen for the vaccine and those in circulation, the vaccine prevents influenza illness in approximately 70 to 90% of healthy adults. Here we have the administration summary. That's all for our reporting, and thank you for listening. Here are our references.